Well, maybe you've heard that old saying, a canary in a coal mine. Back in the early 1900s, coal miners would bring a caged canary deep into the mines. If that canary passed out and fell off its perch, well, that meant there was too much carbon monoxide in the mine, and the miners really needed to get the heck out of there. It was a basic, sort of crude early warning system, but it worked. If you're in menopause, you may not be in danger of dying from carbon monoxide poisoning, but there are some serious health risks that could be coming your way. The good news is that you actually have a canary in your coal mine that can be sounding a warning about the dangers ahead. I'm Steve Goldring from simplehormones.com. There are about 1 billion women in menopause on this earth. Many of those women come to me to find out whether hormone replacement therapy, or HRT, is right to treat their menopause symptoms. In fact, doctors, nurses, nurse practitioners, PAs all over the US, Canada, and even the UK trust me to teach their patients about hormones for menopause. Every single day I get 20 emails from women in menopause. They're sharing about their symptoms like hot flashes and night sweats. Patty's bewildered. I just turned 63 and my hot flashes are back. WTF. My menopause symptoms are as bad as they can get. I would say 10. Insomnia is the most traumatic and troublesome for me. I sleep about 2-3 hours every night for years. I'm drenched in sweat at 2:30 a.m. I am experiencing all the worst menopause symptoms. No sex drive, painful sex, hair loss, night sweats, insomnia, hot flashes, so bad I literally jump out of bed thinking I'm on fire, and paralyzing anxiety. Months in a row of a maximum accumulation of 3 hours of sleep, sometimes less. There are no words to describe my night sweats. I imagine hell being similar. Most nights I have them every hour of the night, starting at 12 and lasting until 7 a.m. Night sweats are so powerful they could wake me up from the grave. My doctor prescribed Paxil for the night sweats. 3 things to remember about hot flashes and night sweats. Number 1, hot flashes and night sweats are no joke. They can be absolutely devastating, and you may know something about that already. They just might be taking over your life and making it completely miserable. Number 2, hot flashes may or may not go away. Some of the women I hear from are in their mid-60s, 12, 15 years past menopause, and still suffering hot flashes. And number 3, hot flashes are a warning sign, kind of a canary in the coal mine, and that can be a good thing. I had a conversation with some hormone providers at a conference several years ago, a mixed group of men and women. One of the doctors in the group commented that women with severe hot flashes are the lucky ones. Those women are motivated to do something about their hormones. The canary in the coal mine, hot flashes and night sweats, warns you, sometimes in a dramatic and painful way, that there's something wrong. Menopause isn't a disease, I want to be clear about that. But menopause does mean your body has low levels of crucial hormones. Your body doesn't have enough estradiol and other hormones after you go into menopause. That's the root problem. That's the whole reason why you're having hot flashes in the first place. That canary is letting you know that if you continue without optimal hormone levels, you're way more likely to have some serious health issues over the long term. Within 10 years after menopause, you could lose a lot of your bone strength. Low levels of estradiol weaken your bones, often leading to osteoporosis. Women email me about osteoporosis all the time too. I think I would be a 9 on a scale of 1 to 10 because osteoporosis caused my 2 bad spinal compression fractures. That's not even mentioning my other symptoms from being postmenopausal. I'm 63, soon to be 64. In 2022, I fractured a vertebrae. In 2023, I fractured another one. I was never told by doctors prior to that I should have a DEXA scan, kind of a bone scan. Once they ran one, it showed osteoporosis. My lab panel showed all my hormones are well below normal. It's been hell. Well, this is my own mother-in-law, Catherine. Maybe 6 months before she passed away at age 101. She did adore me, by the way. I'm pretty sure Catherine took hormones for just a couple years after going into menopause and then stopped. The last 10 to 15 years of Catherine's life included 2 broken hips, at least 2 major surgeries, and 2 stints in rehab hospitals. She had several compression fractures in her spine, basically causing her vertebrae to crumble. She had severe chronic pain that was caused by those spinal fractures. Catherine was confined to a wheelchair, and she was in a nursing home for the last several years of her life. Unlike many of the women that I hear from, Catherine may not have heard that canary in her coal mine. She didn't have those major menopause symptoms, so she couldn't hear the warning or heed it. She ended up living a long life, but she paid a high price in the form of chronic pain and the loss of her mobility, especially the loss of the independence that she deeply valued. If you're considering hormone replacement therapy to manage your menopause symptoms, then that canary might just be doing her job. She's getting you to wake up and maybe take some action. Those hot flashes and night sweats are warning you that osteoporosis might be in your future, and that's not something that you want to have happen. So what's the solution? How do you get relief from those devastating menopause symptoms like hot flashes and night sweats? You could drink herbal tea and practice yoga, dress in layers, eat better, maybe try a vegan diet or a keto diet. You could take more vitamins and supplements, maybe start on an antidepressant. But keep in mind that those hot flashes are a direct result of low estradiol. The root problem in menopause isn't the lack of herbs or exercise. If you're not addressing the root problem, you'll never really be free from the symptoms or the risks brought on by that root problem. Also remember that hot flashes are a warning sign that you may be in for a bumpy ride in the future. The health risks that you're going to face are a direct result of the loss of estradiol, especially osteoporosis. Are you ready to listen to the canary in your coal mine and take action about your hormones? It's possible that you're interested in optimizing your hormones, but you still might have some questions. When you're ready, I'd love to help you make your own HRT decision. I've created a digital course called the Menopause Solution. It's designed for women just like you who've experienced those difficult symptoms of menopause. This course helps you answer that question. Should I take hormone replacement therapy for my menopause symptoms or not? It helps address your hesitations and your fears. It answers a lot of those questions that I hear from women all the time. I want to see you get relief from your symptoms, but also reduce your risks for bone loss and osteoporosis. Visit my website at simplehormones.com/decision for more information about that course and how it might be able to help you. If this video has been helpful at all, click the like and subscribe buttons. Be sure to ding that little notify bell to get a notification whenever I post a new video. Hey, thanks so much for watching, and I look forward to talking with you again next time.